with you here and our Facebook Live, and we have a special guest on this summer. I guess we're still in summer, but some would say it's fall because school started. But this is summer still technically, and school is getting going. But we're going to have our special guest, Michael Isaacson, Assistant Director of Community Health at the Kane County Health Department. And we had Michael on a few months ago, but he's going to come back again. Now, let's welcome Michael. Hello there, sir.
Hi, John. Thank you for having me on again. It's a pleasure to be here.
Now, here I'm putting out my welcome Matt. I had a Matt before come on, but you're Michael. It's a welcome Michael thing here. So we're welcoming Michael here to be with us again, and just appreciate you coming, taking some time for your busy schedule, and a lot of things happening here on this health front and COVID front. So I just thank Michael for being with us. So you want to give us a little update, maybe what your just general thoughts, what's happening in Kane County on COVID-19?
Sure, absolutely. I think most people have probably seen on the news and seen in our own communities that with this Delta variant sweeping across the country, we've seen quite an upsurge in the number of cases. So right before the 4th of July holiday, we were averaging about 10 cases a day in Kane County. And currently we're averaging over 100. So a tenfold increase in the number of cases each day. And this is going on actually much worse in many places in the country. The Centers for Disease Control classifies each county based on how much COVID spread is occurring. And about 95% of the counties in the US are in the highest category of spread right now. So there's a lot of virus activity right now.
Yeah, it's out there. And I was talking to Michael just before Lil got on air here about this. I think I'll put it up real fast here. I'll take myself down. This is the New York Times website. I don't know if you can see the data there too well, but it just says, I think we're at 21 per 100,000. I think maybe is that I can't read that as well as I should. It's small on the screen here. But anyway, that's got different data, and that's respectable. It's not, it could be, there's counties that are in 100 range and more per 100,000. So we're, I think we're pretty good. And the other counties in the state too, right, Michael?
Absolutely. And I think that's one thing to keep in mind is that with viruses, they do ebb and flow. And the things that we do to protect ourselves, whether it's getting vaccinated, wearing masks, trying to maintain appropriate social distance from people in crowds and things like that, that may not stop a wave from coming through, but it keeps it down. So as you pointed out, we're right around 140 cases per 100,000 residents.
No, that's not right.
Yeah, this is per week, so it's a different.
That's the number per week, not per 100,000. That's just
right. And in a lot of places in the nation, it's over 200, 300, 400, 500. So because we have a pretty good vaccine rate here in our community, we want it to be better. There's still a lot of people who are more susceptible because they haven't been vaccinated yet. So we're always trying to reach out to people and give them the information so they can make the best choice for themselves. But from a public health perspective, we certainly hope they choose to get vaccinated. But we've kept our spike relatively low here in Kane County compared to what other places with lower vaccine rates are seeing.
I know we have. I want to put up the 1 second here, and we'll just get one more statistic. I've been putting this on my website. This is on xpn.news website, some of the numbers. I'm going to take down that bottom part too. The county, this is up till yesterday, and the county today, we got some new numbers, just came out a little while ago. But you can see that this is up to date on the state. Like we've had 5,100 new cases in the last day, I guess. I mean, that's how they do this. Over the weekend, they've been not doing weekends differently. They do 2 days on weekends. They don't do them every day on weekend. But so we're at 51 and we've had 25 deaths. Now, the county down there, that was for yesterday, but today it's about 170 on cases, I guess. And
Right.
the deaths are holding at 829. So
And
in Aurora, I haven't
unfortunately,
had numbers in a while, so they were just holding off on that. Well, okay.
I was just going to say, unfortunately, on Friday, we had over 200 cases, and that was the second highest single day total that we have had since January. So even though we've been holding this wave down a little bit lower, we're about where we were in the spring when we had the wave. But still, some of these days we're having pretty high case totals. And unfortunately, we've had increases in the number of people being hospitalized with COVID almost every day for about 40, 45 days. And most of those people, 90+% of those people, 95+% of those people are not vaccinated. So that's what we're seeing is who's most susceptible right now.
Yeah, that unvaccinated crowd is what we're trying to persuade here to get those vaccinations. And so let's talk about some of the restrictions that we have right now. You know, the governor has put on a mask mandate. You want to explain some of the restrictions we have in Kane County?
Sure. Yeah,
Masks, vaccinations, other restrictions, whatever they are on this.
absolutely. And these aren't Kane County specific. These are things that have come down from the governor's office. As you mentioned, there's a new mask mandate that went into effect this week. So when we're indoors, and this is something I think that's getting people's attention is regardless of whether or not we're vaccinated, we're being asked to wear a mask now. And this is because, and this hasn't changed. People who are vaccinated still can have the virus. They still have the potential to pass it on to others. Much lower likelihood, but it still can occur. So as we're riding through this current wave, I think this mandate with the masking is really intended just to be one extra layer of protection. A second thing that's come out is new vaccination requirements. There previously had been some requirements for some state employees, but now there are new requirements not only in education, but also for people working in congregate settings. So again, these are higher risk areas where there may be more exposure to people who are either susceptible to being seriously ill, or in the case of education, where you may be more likely to be around people who can't get vaccinated. So that's going to go into effect next week. And for people who still opt not to get vaccinated, they will have the option where they can do regular testing. And again, those are just steps at the state level that they're putting into place just to try to provide an extra layer of protection for people.
Yeah, talk about mandates. Some people talk about, I mean, they get on that. Well, there's health mandates in areas, maybe you can give a little update, on tuberculosis. You've got to have your testing on that, right? In
Sure.
various settings, right?
Absolutely. And for school, we're all pretty used to, for children entering school in different grades, there's certain vaccines that are required. Now the vaccine's not required for students now. I don't know if it will be in the future or not. But these vaccine mandates are something that we already have in society, and I think it's kind of in the background. There's some people that find that worrisome. But for most people, they just kind of go along and understand that that's a step we have to take to make it safer for all of us to be out in the community.
I think so. I'm going to give you a few questions, Michael, if you don't mind. I think I got 3 people have given me a text on some questions. One is from a pastor that I know, and what's your thought on how long the mask mandate will be in effect? What's your thoughts on that?
I would only be guessing. This again is a mandate that's come down from the governor's office. I'm not exactly sure what criteria will be used, but I know it was put into place as an attempt to slow down the surge that we are seeing across the state. But I don't know how long it'll stay in effect once we start to see a decline in cases. And I can tell you, though, John, that I'm pretty optimistic, even though we're seeing an increase now. And in the last week, as I mentioned, we've had some pretty bad days in terms of case totals because people in Kane County are stepping forward and getting vaccinated. And because I do see a lot of people who are wearing masks, I think that we're going to turn this tide here pretty quickly. So I'm hopeful in the next week or two that we're going to see a decline in cases, and I think that decline could be pretty steep, actually.
I know some states and have had some reductions. Some areas I think my cousin out in California in our one county, the big county of Orange, I think had some reduction. So, and we know masks and vaccinations work together. The lowest hospitalization rate, according to that New York Times data, and I'm sure that's CDC data, but is Vermont, who's got a high vaccination rate, and I'm sure they're doing the masking. So everything pulls together, it helps to lower it. And so, well, hopefully, I think that's a good prediction. It could happen that way, really.
Definitely.
And here's another question. I want to get, excuse me 1 second here, folks. I'm getting my phone ready. Could you cite vaccination rates? Okay. I would like to ask him to cite the vaccination rates compared to the rising COVID cases in the country, but I'm sure you already thought about it. Okay. The vaccination rate and the COVID cases, they go together somewhat, don't they?
They absolutely do, and I think there's maybe two things I'll point out with that question, because that's a really good question. The more people who are vaccinated, the less cases of COVID we can expect to see, and certainly we're going to see less hospitalizations and less death. I will point out, though, that even in places with amazing vaccine rates, let's say, so in Kane County, about just over 75% of people have had at least one shot out of the population that's 12 and over. 25% of Kane County residents 12 and over, that's still a lot of people who are susceptible to COVID. So even with outstanding vaccine rates, there's still a tremendous, I mean, tens of thousands of people walking around who are more susceptible. So we want to keep getting people vaccinated because that's the best thing we can do to protect them, especially our vulnerable populations.
Yeah, I think Pfizer is working to get a emergency authorization for the younger ages. What would that be? Maybe 6 to 12 or something
Yeah,
like that.
we're hoping to see that with the younger group here sooner than later, hopefully in the next month or two.
Yeah, that's what I heard. Maybe by Thanksgiving or sooner.
Right.
Yeah, that would be good because our kids at school and everything like that. And that's one spot where if things, about the masking and et cetera, that's could be an area of vulnerability. The schools going back.
It's not only an area of vulnerability. Obviously, I work for the health department, trying to reduce the burden of this disease is our primary focus. But for those young people who don't have an opportunity to get vaccinated yet, this is also creating tremendous hardship for families. So as kids show up to school who may be positive, that creates a situation where kids around them or students around them may need to quarantine, and that's no small feat for families. So the sooner we can get more people vaccinated so that we don't have to do the quarantine, it's really placing a tremendous burden on our schools and on our families. And I would say it's essential that we do it right now. The work is hard, but we have to do it to keep people safe. But the sooner we can get people vaccinated, it's going to make life a lot easier.
Okay, I have I'm gonna get. Here's one of my favorite people, Marge. Here, what'd she say? Is there a better way cooperation on vaccines and masks in the local churches? Now that's I've been trying to work on that one, Michael.
Yes, yes.
Yeah.
Yeah. So hello, Margie. Nice to hear from you. Just like people, there's a lot of variability between churches. So we've worked very closely over the last year and a half with a lot of churches. We meet every 2 weeks with a group that now, when cases went down, we started meeting monthly. So there's a lot of people taking this very seriously and that are really trying to follow the science and trying to do what they can to protect their membership. And even within a church, it's made up of people. So pastors are working with people whose views on this whole thing run the gamut. So it's challenging for them too. But I would say overall, we're seeing pretty good cooperation in our churches in terms of people doing pretty good practices. And then of course there's churches that are not. But I would say that they're more the exception.
I think so. And Pope Francis had a PSA video that said vaccinations is an act of love to do that. And I thought it was basically in Spanish for the Latino community in the Southern Hemisphere, but it spoke to everybody in the States here too, that it's an act of love.
Right.
And
I know people are tired of hearing the talking points, but the vaccine is the best way to keep you from getting hospitalized, but it's also that's the best thing you can do to protect your family and your loved ones and people you're around. Absolutely.
yes, it's more than just you. I think that sometimes people think this whole thing is about you, your freedom, you're this, but this is totally about how we act towards others too. This is just not an individual type of thinking here about vaccinations or just it's just not a good thing. Oh, I want to put Marge back up again because she gave us she liked to see both of us, so that was good. I don't know if you know Marge. I know Marge a
I
little.
do, of
I
course.
do too. So
Yeah.
I guess we got the word out that we're doing this, and she's here. Thank you, Marge. Let me see. I got a couple more questions here from people. One is, how does you think there's eviction moratorium? It's I think in the state it's going to be till the end of September. The federal just went away. How do you think that's going to affect their vaccination or COVID rates and things along that line? What do you think about that one? I know that was the logic for the CDC to do the moratorium, that it's going to just wreak havoc, and probably it's right. But what do you think? I don't know. What are your thoughts on that? Is it going to do some effect on? It depends, I suppose, how much we got renters in our county and et cetera. But anyway, what's your thoughts on that?
Yeah, that's a complex issue with people who own property and renters, and we certainly don't want to see a bunch of people tossed out uh, of their homes. And we do know that if people do end up without some place to live and they end up in more of a congregate setting, that does increase more people who are together in a crowded space, increases probability of spread of the virus. But certainly, I don't want to oversimplify the issue because I know that the moratorium, there's a lot of things involved in that.
Yeah, there are, and folks, if you know of somebody that is in that situation, contact the Neighbor Project in Aurora. They're handling those type of issues and help. So the Neighbor Project, also Hesed House has a social service managers that are working on that too with the Neighbor Project. So those two places are good if you need helps on that. Uh, Here's another question now. Um, we want to look at natural immunities and other therapeutic treatments to help buttress the vaccinations. Would that help? This question is about natural immunity and other therapeutic treatments. Do you know much about, what would you say on those, on that front? Are there other helps or something, I guess, besides the vaccination, with the vaccination? This person's not saying eliminate the vaccination, but I guess he's trying to help it more yet.
Yeah, no, I think that's another good question. And we're continuing to get more research at the national level and looking at what's going on around the world. We're still seeing most of the studies, at least that I've seen, are pointing to the fact that if people are vaccinated, that is giving them increased protection, even if they've previously had COVID. So we certainly want people who have had COVID to still go out and get vaccinated. In terms of therapeutics, I don't have tremendous expertise in that area, but if we're talking about a case where somebody's already sick, and it's actually a pretty interesting situation where we're seeing around the country that people who express concern about what's in the vaccine, but emergency room doctors and other physicians are saying that people are willing to try these experimental therapeutics
Oh,
that they know much
horse
less about.
therapy?
Yeah.
Horse?
Well,
Yeah.
and even that, yes. Yeah, that's even well, yeah, that's a horse of a different color, John. That was kind of set up.
Yeah,
Sorry.
they don't, or I had some online, we don't ask what's in the hamburger or the hot dog, but we ask there's a lot of things we don't ask about what's in there. We just trust it.
Right.
And
And I certainly support healthy skepticism, and I fully support people who want to know answers to their questions. There's absolutely nothing wrong with that. That's sensible. But I can tell you that tens of millions of Americans have received these vaccines. We know what happens after people get these vaccines. This hasn't been just tested on a couple of people. Lots of us have been vaccinated, and we're not seeing the adverse effects. Rather, we're seeing tremendous protection. So I don't view this as experimental. Now that the Pfizer vaccine has the full FDA approval, I think that's helpful and hopefully is alleviating some people's concern. And then another positive note is over the past 2 weeks, we've seen a slight increase in the number of people who are coming in and getting their first dose of vaccine. So people who may have held out for whatever reason, they've changed their mind and are stepping forward. And I think that's really a positive thing to see.
okay, this is one that I've heard from some others. I'm gonna throw one question in there, and then we got another one here too coming. Uh, about, do we know of any substantial or even documented deaths from taking just the vaccine?
No, that not the research has not bared that out. We have a pretty sophisticated system. There was a case that perhaps people saw in the news in New Zealand, I think, that's being investigated now. But again, we're looking at the whole world, and just
Right.
in
Millions
America,
of vaccines.
yeah, so many people are getting vaccinated.
Right.
And anytime that there's something like vaccines going on, you always have to look at, well, would this have happened to that person anyway? Because unfortunately, bad things happen to people every day,
Right.
physically. So, I think for us to continue to have a system where we can really evaluate it. We saw a couple of months ago with the slight pause on that Johnson & Johnson vaccine, that's the system working. That's them saying, hold up, let's take a look at this and let's see if we're seeing something that should cause us concern. That pause caused a lot of people to choose not to get vaccinated. But in reality, that pause was showing that we're taking this seriously and making sure that these vaccines are safe.
Yes, I know. I think, the previous administration getting this going and why we're doing it now, I think that's a good thing that the government's, been good on this for us, from the warp. Well, I guess they called it warp speed. Maybe maybe that's what makes people think it wasn't proper or something, but it was just done as, a safe way to get it going. But some of this was already in the can, right? Some
Yeah,
of this type of technology,
yeah,
I mean,
the
scientific,
science has been around. Yeah,
what was it? RMA, right?
right. RNA, yes.
Yeah. Okay. Here's a thought, and I know I've heard some. I forgot the name of the guy. You listen to the news on CNN and MSNBC. I get those, and they had some I forgot the name of the doctor. I think he's out of Minnesota. Well, anyway, it's related to what he commented too. This person's asking, what's the data on just generic? I guess that's my homemade mask and different levels of masks and helping. I know there is. So why don't you give us a little rundown on the mask
Yeah,
story
sure. And
there?
I think, and I've seen several people cite this, and it's probably Dr. Olsterholm
That's
from
who it is.
Minnesota.
That's the
Yes.
guy. Yeah.
And certainly we've worked with his office for decades. I mean, we were working with his office back in the early 2000s when we were doing our flu planning and pandemic
Okay.
planning. I think it's important to understand that none of these things are foolproof, meaning that no vaccine is 100% perfect. Unless you're using a full coverage mask, which none of us are going to wear in our daily lives, it's not 100% protection. So wearing cloth masks, that is something that's going to provide protection. It does stop some of the droplets that we're expelling when we breathe. I think there's some current concern about us being overconfident when we're wearing masks. And I believe this is what he was referencing, is if you're going to be in an enclosed area with people wearing a mask, eventually that's not going to help you. So that's why distance, vaccine, all of these layered approaches are important. But the masks do help. So they're not perfect, but they do help.
Yeah, and the level of protection, like you said, we just should play away from, if you're going to be in a tight situation, you should have the highest quality mask, which what's the KN95 or the N90? I think the N95 is the actual, but K is for Chinese, right?
Sure. And I can tell you the N95 masks that offer protection for more in a medical setting, or if you're very concerned. But it's not easy I mean, people complain about breathing through a cloth mask or a surgical mask. You don't want to wear an N95 mask around all day, because it does labor your breathing, because it's working. It is filtering out much smaller particles.
Yeah.
So I think that's important in a medical setting, and God bless the doctors and nurses and people who are wearing those masks day
Right.
in, day out, because I mean,
Yeah.
they're heroes. But for most of us, I'm not going to be wearing a N95 mask
Yeah.
around.
And I know a lot of people wear surgical masks. Now I think that, we'll say Michael
Olsterholm. Mm-hmm.
Yeah, Osterholm, he had a different levels for each one of these
Right.
masks, and the surgical's in between there a little, and that's, but if you're not close to people, that's going to be the best thing, actually.
Sure. And I
Yeah.
think it's just like, if you want to avoid car accidents, okay, don't drink and drive. Drive the speed limit. Wear your seatbelt. Like, these are all different steps, and they
Right.
all help in different ways. But if you do all of them, you're much more likely to be safe. Same thing. If I'm vaccinated, if I avoid large crowds unnecessarily, especially in times like now where we have increased activity with the virus, hopefully a month from now we'll have much fewer cases. And again, just looking at this in terms of probabilities, the likelihood of me going and being with 10 people that one of them has COVID is higher now than it was a month and a half ago.
That's
Hopefully
true.
a month and a half from now, it's going to be lower, and I can feel a little more safe, potentially being with somebody, potentially taking my mask off, etc.
Right. Right. And like we said, you still can carry the COVID even if you're vaccinated. But the deaths from vaccinated, when you're vaccinated, extremely low or almost zero, right?
Yeah, it's very low, very low.
You can get sick. You could get a minor, uh, what we call it, a breakthrough. I guess that's the term they're using.
Mm-hmm.
But anyway, vaccination is the way to go. And I'm just going to you have a couple vaccination sites currently, right? Is that correct?
Yeah,
Batavia and Elgin?
so Elgin is not active right now.
Okay,
We're
just
focused,
Batavia then?
yeah, just Batavia, but and we haven't really talked about it here tonight, but with the talk about booster shots, we're waiting for the formal guidance on that. but we're ready at the health department and with our other community partners. If we need to open more sites, we can. But there's plenty of vaccine out there. So if somebody wants to go to the pharmacy, wants to go to a clinic, wants to come to one of the health department sites, there's some place I can guarantee that's convenient to where somebody is, where they can go in and quickly get a vaccine,
Yeah,
and it's free.
yeah, we have a couple. We have the VNA site, and we have the Kane Vax site.
Right.
That's where you can get more information and get appointments to and everything. And here's the Kane County, health vaccine appointments. And so there's a lot of ways to get the vaccine. Really, that's not what's probably holding back our people here.
Right.
We got so many places, all the pharmacies and several sites, and the VNA will come out to you too. That's another thing that I found out, that they would go to you. That's a very nice thing too. So homebound. So I mean, there should be no question about getting how you can get the vaccinations. So
Yeah,
what's some of your final thinking here about the future of our endeavors here with COVID and other things with health in Kane County, Michael? What would you say?
sure. And not to put too sharp a point on it, I what we're seeing right now with the increase in hospitalizations and the increase in cases, most of those are preventable. So if we can get more people out and get them vaccinated, then unnecessary suffering, unnecessary hospitalizations, and most importantly, unnecessary deaths can be stopped. So, like I said, we're in a period right now with increased activity. But I think if people continue to do the right things that they know will protect them and those around them, I'm hopeful that here in the next week or two, hopefully we're going to see a decrease. Again, I'm making a projection, but we have seen decreases in other places in the world and other places in the country. So I'm hopeful that we're almost through this wave.
Yeah, let's hopefully see that. Of course, then I saw just today there might be another variant. So the only way to really get a handle on this is to get vaccinated and do other protections, the social distancing and mask. And I guess the surface thing is not quite as important as it. We've realized it's mostly through airborne, right, Michael?
Right. Yeah, absolutely. I mean, it's always a good idea to wash your hands.
No, right. No,
But
we still should do
yeah,
that. But basically, we don't have to clean down everything under the blue moon.
right.
We just got to worry about the airborne, really. That's where it's coming from.
Right.
Yeah. Well, thank you very much, Michael. I'm going to give you my thank you here.
Yeah. Thank you for having me.
Yes, thank you. And we're just going to see on Friday. We'll see what we have coming up. That'll be a work in progress here. We still haven't got that one down yet. But again, thank you, Michael, for coming by and being with us. And you can see at the bottom of the screen some of the ways you can get your vaccinations. And start coming down the road is also the flu vaccine here too. So we got a lot of things happening here. And and then that third dose for COVID. So we got a lot of things happening, and we just got to beat this virus back and whip it back and put it under, just get it under our belt and get rid of that guy. So again, thank you, Michael. So I'm just going to say to everybody out there, see you Friday, and just thank you for listening. And again, thank you, Michael. So God bless out there, and everybody, bye-bye, and we'll